Most people think joint damage in RA happens over a decade, but the truth is significant irreversible damage actually starts in the first 6 months of feeling your symptoms. But there's a good news. Treating it early does not manage just the pain. It can actually change the course of rheumatoid arthritis. Hi, all of you rheumatoid arthritis warrior. This is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc, and a practicing rheumatologist here at Empower Arthritis and Rheumatology Centers. As we discussed in the last video, the time is so crucial in rheumatoid arthritis. And in today's video, I'm also expanding more on why that's the case and how do we use a holistic way of managing rheumatoid arthritis. Please stick around. Before I go further, don't forget to like and subscribe to our videos, and also let us know what type of content do you want to hear from us. Please put comment in the comments below so that we can understand better about your needs of what type of information related with rheumatoid arthritis could help you. And also don't forget to accept our gift that includes a free copy of the Holistic Rheumatoid Arthritis Guide, as well as a free smoothie that you can prepare every morning to fight against rheumatoid arthritis. Now, quickly recapping on what we talked last time, we talked about treating early RA can save your joints. As we all know, rheumatoid arthritis is a chronic systemic autoimmune disease where your immune system is just hyperactive. There's unusual fire in your joints, and that fire could cause long-term joint damage. So we need to put out that fire using medication as well as lifestyle changes. So we talk about the importance of putting that fire out early so that it does not burn your joint, causing joint damage. So that is the most important point that we need to remember in rheumatoid arthritis. So in the video today, I'll go over the complementary actions that we can take to better manage your rheumatoid arthritis. Now, when we talk about the complementary treatment, we need to look at the holistic way of managing rheumatoid arthritis. And that includes exercise, education, and a teamwork. As we discussed, RA is a systemic disease. Hence, we need to have a better system. And within the system, we need to have multiple people that help you manage your rheumatoid arthritis. You cannot manage your RA by yourself. You need a team that includes your primary care doctor, your rheumatologist, which is one of the key players in managing rheumatoid arthritis, your physical therapist, a pharmacist. Now, pharmacist has an important role in helping you manage RA. And the reason is RA medications are complex. They have side effects. They have interaction between different medication you are taking. And they can have other consequences of taking those medications. So a pharmacist could help you understand better about those medications. Your rheumatologist will also help you learn those medications, but a rheumatologist along with a pharmacist could help you learn more about those drug interaction and the side effect that we need to watch out. Now, nutrition also become a key important part of rheumatoid arthritis management. Many of the time you can learn by yourself, but you might also need a help with a nutritionist. And in particular, nutritionists who are aware of autoimmune diseases. So they can guide you what are the food that you can add and what are the food you need to avoid. So a nutritionist can give you that guidance. And in some cases, some people who have rheumatoid arthritis, they could also suffer from mental health issues. Unfortunately, rheumatoid arthritis can cause significant life changes that can lead to anxiety, depression, and other mental health issues. So if you have those, you need to have your psychologist or a psychiatrist in your team. So RA management is like having a team of players. You need to have different players in the team. That includes your primary care doctor, rheumatologist, a pharmacist, a therapist, and a nutritionist. So if you have a good team, then you can effectively manage your rheumatoid arthritis early. Now, even though you have a good team, sometimes you need some other tools that help you manage your day-to-day symptoms. That's why understanding how you use those medications safely in a day-to-day basis is essential. That includes some of the over-the-counter medication, such as non-steroidal anti-inflammatory. And the non-steroidal anti-inflammatory, such as ibuprofen or other non-steroidal can help you manage your day-to-day pain symptoms. But the key is they are just helping you manage your symptoms. They don't fix rheumatoid arthritis. So you need to add disease-modifying anti-rheumatic drug to help effectively manage rheumatoid arthritis. But the NSAID could be a tool that you can use to manage your day-to-day mild joint pain. In case of more severe joint pain, such as when you are having a flare, then you do need some corticosteroids or prednisone. So use prednisone as an add-on for your flares. Don't use prednisone as your long-term medication. As we have discussed extensively on the downside of taking steroid long-term in our earlier videos, which you can refer to, but to summarize, corticosteroid or prednisone has a lot of side effects. That's why use them cautiously, use the lowest dose that is needed to control your symptoms and the shortest duration of time. Always be mindful of how long and how much steroid you are taking. Many of the medication that we have discussed on managing rheumatoid arthritis has side effects. That includes risk of infection. So vaccination is a key component of decreasing your risk of infection. So check with your primary care doctor what are the age-appropriate vaccines that you can take. If you are taking those immune-suppressing medication, you might need some additional vaccination beyond your age-appropriate vaccines. So your rheumatologist can help you guide what are those vaccines. Even before you start medication, it's important to screen for hiding infections, particularly TB or hepatitis. Some of those medications, such as methotrexate or other biologics, that can activate any hiding infections. So your rheumatologist always help you get those tests done prior to starting those medications. Now, other third key component in managing rheumatoid arthritis is managing your cardiovascular disease risk. Rheumatoid arthritis is a strong risk factor for having heart diseases, such as heart attack or even strokes. So understanding those risk factors and managing those risk factors is essential in helping you decrease your risk. That includes managing your high blood pressure, managing your diabetes if you have, and managing your cholesterol level is as important. So talk with your primary care doctor, talk with your rheumatologist on how you can minimize those risks to decrease your long-term risk of having heart diseases. Now, we have discussed this in the earlier video on having a target. In rheumatoid arthritis, having a target is essential in how we manage rheumatoid arthritis. And we call that treat to target. So in RA treatment, there is a target, and the target is achieving remission. Let me also recap what does it mean by remission. Remission means minimal symptoms, minimal inflammation in your joints when your doctor examines your joints, and then normal blood markers such as sedimentation rate and the C-reactive protein. Those are the two markers of inflammation. So we should have those goals of getting up to remission. And the reason is, if you have RA and if you are able to achieve remission, your long-term outcome is very good and your overall quality of life is excellent. So always ask your rheumatologist, what is my goal? What is the target we are aiming with those medication and lifestyle changes? And when you have those goals, then you can adjust your treatment based on where you are now. And if you are not doing well, if you are not able to achieve that remission, ask your rheumatologist what we can change, what we can add, or what we can change with your medication so that we can achieve that goal. And that includes biologics or other disease-modifying anti-rheumatic drugs. Fortunately, we have so many combinations of drugs that you can use to manage your rheumatoid arthritis. So don't get stuck with uncontrolled rheumatoid arthritis. If you are not feeling well, if your joints are still inflamed, always aim to achieve that remission and help your rheumatologist understand about their disease activity, and they will help you control the disease to achieve that goal. And with the available treatment we have, with sequential treatment, we can get remission up to in 75% of the cases. And in the rest of the cases, if we add lifestyle changes, then we can achieve better disease control. So don't underestimate the power of lifestyle changes in RA treatment. Now, all of you rheumatoid arthritis warrior, thank you so much for watching. If you like this video, please like the video and subscribe to our channel, and also share this video with your loved one. At RheumDoc, we have a big goal for 2026. We want to at least reach out to 100,000 subscribers who have rheumatoid arthritis. So please help us achieve that goal so that we can help as many rheumatoid arthritis patients as possible throughout the globe. So help in our mission. Now, these are two important facts that you should always remember. The first one being importance of timely treatment. Delay in treatment increase your risk of permanent joint damage. So save your joints, start treatment early. And initial treatment with methotrexate is our first start. But this is just the start. There are so many other treatment options if in case methotrexate is not effective. We have so many other disease-modifying anti-rheumatic drugs. We have many biologics which can help along with methotrexate or without methotrexate to achieve that goal of well-controlled disease in RA. And always remember, we can prevent the house on fire. We can prevent joint damage if we aggressively treat early with close monitoring. And let me also reiterate the importance of monitoring. We understand the medication that we use for RA has side effects. So the key is close monitoring of your symptoms and regular blood work by your rheumatologist. With those, we can minimize the side effects. And there's always the benefit of early treatment. The early treatment transforms the whole course of rheumatoid arthritis, and it will transform your life. If you treat early, you may not even feel the pain of rheumatoid arthritis. You might be taking some medication, but your quality of life becomes significantly better if we treat early. So from this small fire, we can prevent the whole house being burned down. We can prevent your joint from damaging, which is irreversible. So help protect your joint. Thank you so much, all of you rheumatoid arthritis warrior, listening to us in this video. And then please, if you like this video, please like and subscribe to our channel. And then let us know how do you like the video, what are the other different content you like to hear from us, and we'll be coming with those content in the future. And always remember, you are not alone in this journey. We are here to support you in your fight against rheumatoid arthritis, providing you with scientific, authentic medical content in our channel. I'll see you next time. Bye-bye.